Good morning.
Good morning, Kathy.
I have my team here as well. So just an update, we've reactivated our Public Health Incident Command Team, or our DOC as we call it, our Department Operations. So we started in January, just virtual. March 9th, we did partial, and we are in full activation now as of March 16th. So we are there Monday through Friday, and then we are virtual on the weekend. So we're in full operations because of this disease outbreak, obviously. Our role is a lot of the communication. So we're getting communication out to the public via social media, press releases, TV, et cetera. So there's a large cry for information, so we're trying to meet all of those needs as much as possible because it takes quite a bit of time. We're also providing, as you know, a press conference on Wednesday, and so we'll be doing that at 11 o'clock with Fargo and West Fargo and the Mayor of Moorhead. So we'll be providing information at that. I think that's going to continue weekly, is kind of what they are discussing at this time, because this is such a changing and ever-evolving situation that weekly updates are probably necessary for the public. And we've also done, as you are aware and as you have sanctioned, some of the things that we've done within the county, and we'll continue to look at some of the changes that we need to make besides the remote work, et cetera. There is, as you can tell, a shortage of test kits out there just nationally. We have been in communication with our health partners across the river. So far, they said they're able to keep up, and they are not experiencing the shortage that is happening globally. So the number of cases in Minnesota jumped up. It was 169, and then as of yesterday, it was 235 positive cases. Again, that's just because they were able to catch up with the testing. Mayo Lab helped the Minnesota Public Health Lab catch up with their backlog. So when we see that large increase, it's just that the testing has been able to be caught up. We're still going to see increased cases. We're going to see this, the spread, community spread. It's spreading across all of the states now, community-wide. So it's not just specific to international travel. So we're going to see increases in that. We, of course, as you've noted, we have the one death so far in Minnesota. So our messages are loud and clear about the social distancing, about the washing your hands, not touching your face, not shaking hands. All of those messages are vitally important for people to know. That's the best way right now they're still doing research on antivirals and a vaccine, but that's going to be a while before it comes out. So the best protection people have is just your personal protection. Remember, surfaces, they're saying the virus can live on surfaces from a few hours to a few days. And as they research that more, that may change, but that is the best information out there now. So we have to know that surfaces are contaminated. So if you're touching the surfaces and then touching your face, that's a good way for us to get infected. So in the incubation period is anywhere from 1 to 14 days. Average is about 5. So by the time you contracted the disease and are symptomatic, that's kind of the average is the 5-day, but anywhere between 1 and 14 days. So, we're mindful of that as well. There's people I think are aware of going to the grocery stores if you have one family member that can do the shopping, going to the grocery stores in limited numbers, all of the things that we're experiencing within our community. We also know that the changes are causing a lot of stress, and the stress level is going to rise. So we're getting information out about how to cope with stress, what kind of things can you do at home, et cetera. That information is going out. We're providing information in the school lunch kits that are getting out, so all the schools are providing lunches, meals for kids and families, so we're getting that information about how to cope with stress, and then how do you recognize that in your children, because the children will certainly experience stress as well. Just such a big change in the way we're operating now. So we want to be clear about the messaging in regards to, helping to spread that, coping with stress, and continuing some things at home with the gyms being closed and people are, the activities, they have to think of other means. How can you get your activities? Because we do know that physical activity will help with coping with the mental and the stress. So we want people to continue to do activities as much as they can without having the availability of the gyms to go to. Josh, any updates from anything else, or Jamie?
Just one thing I want to point out is our public information team is doing an excellent job of sifting through questions that are coming into the public health office and going back to the Minnesota Department of Health website and the CDC website and addressing facts. And so, because there is a lot of research that's going on out there and a lot of things that are being discussed, that's coming into us. And again, we can only focus on what's factual and what's true. As we search the CDC website and MDH website, sometimes there aren't clear answers because they are still learning and testing as they go along. But that's an important piece for us, that we get the message out of what's actually on the Minnesota Department of Health CDC website. The calls and communication with our healthcare providers also is important, so that if we get calls from citizens, we refer them back to their provider. If it's Sanford, Ascension, the information they're posting, because there's clear guidance from our healthcare providers in terms of what they expect. If someone has symptoms, they want them to stay home and care for themselves. Clear guidance on when they should call and ask for assistance. And an important message also that they're putting out there is, if you do call for assistance, if you call 911, that you clearly identify to dispatch. Is it that you are in the testing? Have you assumed you have it, or have you been positively tested? So dispatch is clear in terms of what they are in. That's what I was thinking of. Anything from your perspective, Josh?
Well, and I want to just mention, we're working with the homeless shelter, because there is a concern about what will they do if somebody is ill, or if someone is even positive. They don't have the ability to keep somebody safely quarantined. So we have an individual on our team that is working directly with them to try to determine what are we going to do with an individual that is homeless, and where are we going to place them. So we're working on those plans, and hopefully we'll come up with some solutions for that. We also want to note that, as you've seen in the media, blood donations are down, so anyone that's well and has the ability to donate blood, that's still vitally important to get the blood donations in. And then those with the dental offices are reducing the services they're providing, so they're trying to not provide some of the routine services, but really looking at those urgent dental needs. There's an increase in people going to the emergency room because of that, so we're urging people to contact their dental providers, because they'll still provide urgent needs. They just are trying to reduce the numbers that they're providing. A lot of it has to do with the personal protective equipment that they're trying to reserve, and so they're really trying to just deal with those. So those people with dental needs, instead of going to the emergency rooms, are really trying to get them to contact your dental providers, and then they'll work with you on that. We're really trying to flatten the curve. So we talked about flattening the curve, and that's what we're trying to reduce this big surge of infection, because it will tax the health system. So really flattening the curve is trying to do just what we're doing, trying to decrease the virus from circulating by doing all the things we can to reduce that. So flattening the curve is the important thing, just so we don't have a big surge in the healthcare systems right now. So that's pretty important, that we all are vitally important in practicing those things that we address all the time. So that's a big message, and we're going to continue to pose that. Wash your hands, cover your cough, those kinds of things. Do you have any questions that we have not talked about?
I can wait.
Oh, okay, Kevin?
Thank you, Kathy, and Steve, I think we should get this weekly update, and I would like to request that we can get breakdowns of this meeting, and I think the segment that Kathy provides to us, a link should go out to all of us on that, and because I'd like to be able to share it on social media. Social media right now seems to be, everybody's home, and this is their source for information, and I think we need to really use it as much as we can, and I think hearing directly from public health is extremely important, and with what you mentioned about, you deal with the facts, and there's so many things that are going on out there and set out there, and a good source to go if you do have concern or questions. There's, public health is probably the right place to go for that. I certainly don't have the answers to a lot of those things, other than the fact that we listen to them to make policy decisions. Mm-hmm. So you're the right people for that, and thank you for going to the press conferences too. I mean, I think people would rather hear from you than us on this. So thank you for that, and I would just urge, and then also on our, whatever you can do in working with our website on being able to keep things up to date on this. That's a good thing, and sharing that link, we can share that link as well through social media. Right now, that's where everybody's going for their information. So, thank you, Kathy.
No, thank you too for. We get all kinds of information through our newspapers, through our TV and stuff like that. But it's nice to get it locally from you, Kathy, and your staff here. Thank you so much for coming here almost weekly now. So, and I think we'll continue doing that till we're over this COVID-19. So, thank you so much for that. Any other comments? Okay, thank you.
Thanks.
Gabe, did you have anything that you want to present today?
No, I came to support Kathy and public health. I've been working with them closely, and they're doing a great job.
Okay.
Supporting agency to public health right.
Mr. Chair, if I could, yesterday we received an update on our other state of emergency. Is there anything that you would want to share pertaining to the flood? If you would.
I just want to say one thing, that Gabe is an essential part of our team. He's there every day with our briefings, and so he's vital to our incident command team. So didn't mean to leave you out from that.
Thank you. Regarding the flood, obviously the flood forecast, the latest one, it's looking good. We're having a nice melt. The weather looks like it's for the next 10 days or so is going to be cooperating. I did touch base with Dave Overbo yesterday from Highway Department, County Engineer, and they have been working, if he hadn't informed you already, they are working on kind of clearing some ditches and culverts and stuff, those vital areas. He said they have their their de-icer for melting ice and stuff out of culverts, ready to go. And so they're just kind of playing the weather, playing that by ear and working on their needed areas right now. So right now things are looking good. I mean, we've got our plans in place, and Highway Department is the pointy part of the spear right now, and they're doing what they need to do to help the water flow better when that happens. I do have a big concern on field debris. I do think we're going to probably have some plug culverts and whatnot due to corn stalks, and so they're going to have to be on top of that. That, if that starts flowing and plugs up a culvert, it doesn't take long for a section to get flooded out. So my big concern is the overland stuff, but right now the melt is cooperating with us, so that's good.
Okay.
Any questions regarding that or anything else that emergency management's been working on?
I have it. Gabe, back on the COVID-19, I think I just read here nationally that in terms of your area with emergency services, that there's been some concerns about protective equipment.
Yeah, PPE.
Are you running into that?
Absolutely. So I had a meeting with a phone conference with the state EOC. This was I think, end of last week when they gave the update on that. And most PPE, like the N95 masks, are one you hear a lot about. Gowns, they're recommending, like first responders and whatnot, if they're going into a call that, they may get exposed to it, to wear a gown. The state EOC is reporting that most of those supplies are on an 8 to 10 week back order. So fortunately, we were able to scrounge up some of that stuff, and I've been distributing that out to our local first responders, a lot of the volunteer groups and whatnot. We did find a supplier yesterday for some face shields. We're also recommending eye protection, so hopefully we have 5,000 face shields coming in the next week or two, and then I'll disperse that to PDs, fire, rescue services. But yeah, it's in short supply. So I guess if any of you happen to have anyone talk to you about donations, I know a lot of construction companies and things of that nature use N95s for like when they're cutting concrete and stuff. So if you do hear of anyone or know of anyone that may have some of that stuff to donate, put them in contact with me, and then I'll make sure it gets out to our first responders. I did have an email this morning from Apple Tree Dental out of Hawley, and I think they're doing a lot of the services that normally would be done over at the public health building at the dental office over there.
Sure.
And they are in need of PPE too, so I did relate to them that if I came across them, I would try to make some available to them also. So, like I said, it's good to put the word out there, and if anyone has ideas on donations, pass them.
So do all of our deputies that are out, do they have some of that equipment right with them that if they sense the need, they have it?
They do, and we've changed, most law enforcement agencies have changed some of their policy on responding to medicals. So dispatch asks the gamut of questions when someone calls in on a medical type deal. And if they answer yes to certain questions, like let's say they have a high temperature and things like that, dispatch gives out a certain code when they dispatch it out. And if it's not a life or death, like a CPR in progress type deal, our deputies don't need to respond. They will wait for FM ambulance. Okay. They've got more gear and equipment than our guys do, and they have procedures on how many people they're sending in. The other ones that are probably going through gear faster than our law enforcement are our first responding agencies, volunteer ones like Holly Hurt, Ewan Rescue, Sabin Rescue, because they're still responding to all those calls, and they've changed a lot of their policies and procedures on maybe just sending one person in initially if it's something just to get some information from the patient so they can pass that along to FM ambulance.
Okay, thank you for that update. Anything further?
Steve, if we can have his part included with Kathy's on that link, I think that's good.
Absolutely.
Thank you.
Thank you, Gabe.
Thank you.